Welcome to the Brooks Rehabilitation Podcast. My name is Tracy Davis. I will allow our guest to introduce himself in just one brief moment, but I wanted to remind you to check out brooksrehab.org and also all of our social media channels. Any social media platform, we're on there. Check us out at Brooks Rehab. We would love for you to get to know more about us and all the things that we have going on and all of the great programs that we offer our patients. And now I'll allow our guest to introduce himself and we'll get right into the episode.
My name is Steve Walczak. I am a physical therapist by trade, but my role right now is the rehab program manager. And within that role, I serve our teams for our fourth floor spinal cord program at the University Hospital, our inpatient pediatrics program, and then also our pediatric day treatment program.
Steve, thanks for coming on the podcast. Let's get into let's talk about Peds Day. This podcast is about Peds Day. I know you're doing a lot more than just Peds Day these days, but So what is a pediatric day program?
Yeah, so pediatric day programs, there's a couple of models of it across the country, but we really developed our day program specific to the needs of our community. By format, our program runs 5 days a week, 3-hour classes. So we have a morning class and an afternoon class. And the same kids come every day, and they'll stay for at least a month of consecutive care. But some kids will stay for as much as 6 months. We've had a few cases even a little bit longer. But really, it's a program that's meant to serve kids in a way that we can give them intensive services, most often after catastrophic injury, and not have to compromise on what care they need, but rather give them exactly what they need and when they need it.
Excellent. Yeah, and I've done quite a few things with you guys over the past few years, especially as you have gotten your new space downstairs here in the University Hospital. And, you know, it's just always great to see all the therapists and how much they love their jobs from what I can tell. Like they just absolutely love working with the kids. And a lot of times, obviously, I guess part of it is making it not look like therapy to the kids because that kind of therapy definitely looks a lot different than any of the therapy going on upstairs. Sometimes it's the same, right? But and you guys get to use kind of any of the different equipment that you need to, right, throughout the hospital. I feel like you need to go. I know sometimes you guys are out in the courtyard, but do you get to go kind of wherever and do whatever you need?
Yeah, so one of the really great privileges that we have is that we're able to run this outpatient program, but we have all the resources of the inpatient hospital, but also the neuro recovery center. So definitely, especially because we have the kids, we do spend a lot of time outside. So yeah. Even yesterday, just an example, I just walked out so I could spend a little time with some of the families, see what the therapists were up to. And I walked and they were doing obstacle course races where they were riding up a scooter board on their bottom. And then one kid was doing hurdles on one side. And then there's all sorts of things going on. So it was really chaotic. It was really fun. All the kids were laughing, having a good time. It's funny because I was hanging out there talking to one of the dads. He's like, yeah, they made us do this last week too. So it was parents versus the kids. So yeah, they're doing all sorts of fun stuff. And I think that it's really great that it is a community program too. And so that allows us to really try and utilize all of our resources as a system. So we pull people like Michael Braun in to do consultations for assistive technology. We're able to do Cyberdyne for the kids that are appropriate for it. Pull in specialists. Like right now, we have one of our speech therapist specialists coming down to do vital stim, which is electric stim to help with swallowing for one of the patients. So we really are able to serve the kids in whatever format that they need, which is really nice. And we just have so many tools available to us here at this hospital. Yeah,
I mean, it sounds like you guys are not stuck in a box as far as the therapy that you can offer any of the patients. So, and I know in my interviews for the videos that I've made with kids that were in Peds Day, the parents seem to just really love the fact that the kid can come home, now that they're out, whether they were in inpatient with us or somewhere else, but now that they're in the day program, in that outpatient setting, they're here for however many hours a day, and they love that they can just go home with them. Mm-hmm. And come back and get as much therapy. And is there, you said up to a month is kind of like the longest that they would actually be in the program?
Well, the opposite. So we actually ask families to commit to at least a month.
At least a month.
At least a month of 5 days a week, 3 hours per day. Okay. And we ask families to commit to be present for that entire time.
Sure.
I do lovingly share we're not a daycare, we're a day program.
Right.
So you can't just drop the kids off and leave because so many of these kids are so medically acute still.
Sure.
Because most of them, literally, they will discharge from the inpatient rehab hospital. About 80 to 90% of them come from upstairs.
Okay.
And then we will evaluate them as soon as the very next day. So we try and make that system progression really, really fast for them. And just because we know that in order to get good neurologic dosing, really be able to make good physiologic changes, we don't want it to just be a 1 week experience.
Of course, yeah.
We want it to be a little bit longer. I mean, you could just think about yourself. Like, you couldn't go to a CrossFit gym for a day or 1 week and then expect to see results.
Right.
You need to really be consistent over time to get, where you want to be. And so we're looking at it exactly the same for the kids.
Yeah, and I'm sure it's smart too to have the parents there, not just for the daycare part of it, but also for the long term. Like, they're not going to be here forever, right? So I mean, a lot of the stuff that the parents can learn here, maybe they can take home and do stuff with them, ongoing.
And that's actually one of the whys behind why we even started it. And so when kids are in the inpatient hospital, upstairs, when I refer to upstairs, I mean they're going to be on the floor, they're inpatient staying overnight. When I say downstairs, they're going to be in Peds Day.
Yeah.
But when they're upstairs, really, we try and educate and we try and prepare as much as possible for the kids and families to be able to be ready for things like adaptive sports and what does getting back to school look like, what does socialization look like. But the reality is that families are not quite prepared. They're not in that stage of coping typically. Yeah. Sometimes they are, but really their focus at that time is emphasized on just getting home.
Sure.
And myself now having a little bit of experience as a parent, I think I can empathize a lot better than I used to be able to.
Sure, yeah. Me too.
The kids in the back seat starts to get a sniffly nose, and all of a sudden my heart rate goes up, and I'm starting to get a little bit stressed out because I'm like, gosh.
My son's had a cough for over a month, and we're like, what's going on? Now he's on medication. Yeah, absolutely. Yeah. All you want is the best.
Yeah, because, you want them to be healthy, but then that your routine helps you as a family to function at your best.
Absolutely.
And all of a sudden that routine is going to get thrown off in some way. Mm-hmm. And so, these families didn't go into this planning for any of it.
Of course.
Right. And so they're just trying to get back to normalcy as quickly as possible. And so as much as our team is amazing at educating while they're spending their time in inpatient, the reality is the parents are so laser focused on getting home.
Yeah.
And then the feedback that I've gotten is the parents get home, they let the dust settle, they, feel good about their training to be able to do that safely. But then they start to look around and think about life before and think about life now. And they're thinking, wow, my kid before was hanging out after school with friends. Mm-hmm. They were participating in XYZ clubs or sports. They were doing these things at school. Now what do I do?
Yeah.
And so, there's just not enough time, to go through that whole coping process and to really learn those skills to be successful there, because that's not what anyone's been visualizing or planning. And so Peds Day, having that little bit longer timeline, helps us to really walk side by side with these families to move them along, because the goal of Peds Day is, yes, we want them to recover, but we want to be able to launch them to the community. So really emphasizing the participation side of our mission. And what we want them to do is to feel really confident that they're not going to be completely reliant on always being in therapy, a couple times a week or for hours or whatever.
Yeah, they're not going to have a lifetime therapist. So, yeah.
Right. We don't want it to be about their time in Peds Day, but we want them to be set up beyond the walls of Brooks. We do hope that they come back and they, can participate in adaptive sports, or they're going to be community members at the NRC or whatever.
Yeah, I was going to ask if maybe adaptive sports kind of fills in some of those gaps for extracurriculars and things.
Yeah, we do try to connect the dots as much as possible, and every kid's different based on their abilities, their preferences, things like that. Some kids leave and they're getting back to pretty much the things that they were doing right before. Mm-hmm. Some kids, it looks very different. And so adaptive sports helps to bridge that gap really well for them. So everyone's quite unique in what they need. after the program. But it's definitely something that we're thinking about and we're planning the entire time that they're with us.
Yeah, and it seems to kind of come up on every podcast, but it's like our system is so unique in the fact that we offer all these things, that we're not just a hospital or just an outpatient system or just home health, but we have all of those things. And then now, like you're saying, a kid can come into our inpatient and then go right into Peds Day, and then now they're doing adaptive sports. So they're kind of like hitting so many different parts of our system all at once right here in Jacksonville, which is going to get, we're going to have to start thinking a little differently now that we got Phoenix coming up and whatnot, but, one step at a time. But it's just crazy the things that we built here in Jacksonville over 50 years now. I'm sure Dr. Brown would be so proud of the things that we built, especially the stuff with the Peds stuff that you're doing. And the Peds Day program I think it's a very special program because people see you guys in the hallway doing stuff, pushing the kids through.
Yeah.
I feel like I've seen them over on the corporate side a few times going through the hallways, and they're doing some OT stuff on the walls. It's really interesting. If anybody has never seen it, we've got videos on our YouTube channel that you can check out of seeing some of the therapy that these kids are getting.
Yeah, it's been an interesting journey, just because we started when we were amidst renovations in the hospital, and so.
Oh yeah, that's right. Yeah.
So I like to kind of tell the story a little bit, kind of the uphill and the snow, wind in your face, both directions.
Right.
But when we first opened the program, our gym space wasn't even ready. So we were just starting to evaluate patients. We were utilizing all sorts of different areas of the hospital, getting really creative. I actually got to be the physical therapist for the first portion, to make sure that I was in the weeds, understanding what we needed to do to be effective, which, by the way, it is a very fun place to treat.
Oh, sure, yeah.
I wouldn't say it's an easy job, but it's a very fun job. And I don't know if I've worked in a setting where I've been able to set the parameters for optimal neurologic dosing the same as I have in Peds Day, which is really cool.
Because you've worked with adults as well in your career?
Yep. So I've worked in early intervention, which is basically pediatric home health from up to 3. I've worked in our outpatient division in a traditional outpatient clinic.
Okay.
For the longest portion of my time here at Brooks, I was the inpatient PT for the pediatrics program. And during that time when we didn't have kids, we would serve adults. And so I started on the brain injury floor, so I would work a lot with kids, but then also adults with brain injuries. And then right before moving into a leadership role, I spent time serving not just the kids, but the adults with spinal cord injury.
Sure.
And that's when we moved up. But coming full circle back to where my train of thought actually started.
Yeah.
You mentioned you even saw the kids in corporate. And when we were renovating our gym, which we're really blessed to have all sorts of resources in our space there, let alone the NRC and the upstairs. But we actually for a while were treating in the corporate space. That was like our home spot.
That's right. Yeah.
So I was nervous at first because I was like, oh my gosh, people are going to be trying to get work done, and we're not exactly a quiet bunch.
Corporate side needs to see a little more clinical.
Yeah, but I realized that it actually was a great win for everyone. The team had to get a little bit more creative to utilize all of our resources. But then also it was just fun because you see people from HR starting to interact with the kids and laughing and smiling and seeing some of the fun things that are going on. Obviously, you yourself saw it going on.
Sure.
So I thought it was just a really cool season for the program to, have to innovate a little bit, but also spread a little bit of the compassion side of things amidst a group of people that don't always get to see that front line quite as much.
Yeah, and so tell me a little bit about the differences in treating an adult and a kid, because in my mind, obviously, with a kid, it's going to be a little bit more fun involved. Even though I do see our adults having fun too, our therapists are really good at adding things that are fun. Even though it seems to be a lot more hard work that's involved too. But what's kind of the mentality difference in whenever you're working with a kid versus an adult? Yeah,
so I think that there's a couple layers to it. So every age group is also going to be different.
Sure, true.
I think that engagement is probably the most stark difference because the neurologic system is the neurologic system. A lot of the principles that apply to adults apply just the same to kids. The thing that makes it more complex is that you have your orthopedic system that you have to consider because kids are growing. You have your neurologic system that's changing and rewiring rapidly through childhood and understanding where they're at that time. But you're using the same principles. You just have to understand developmentally what's happening and then understand, obviously there's a change that's occurred, at least with the population that we're serving, mostly a post-catastrophic injury, and understanding what does that trajectory look like for that kid and then dose and plan appropriately based on that. But I think when people think about pediatric PT, they think maybe even less about that, but it's more about the theatrics, which you even mentioned.
Yeah, because you guys are kind of selling the therapy a little more.
Yeah. And so I think that, like I said, every age group is a little bit different. With teenagers, they can follow instructions.
Sure.
But the problem is engagement.
They're kind of checked out a little bit.
Yeah. Well, and the thing is that a lot of motivation has to come internally directed, right?
Sure.
So if you or I want to make a change, like we have to have the self-awareness to realize that and then actually take steps and actions and self-discipline.
Right.
And, a lot of adults don't even have those things figured out. So we almost have to serve like a mentorship role to these adolescents to help them to engage and understand why some of these things are important. And sometimes it's a lot more playful than that. It's not just like helping them to understand it cognitively, but sometimes it's trash talking with the kids,
stuff they're used to from school.
Joking around with them, giving them a hard time, making it competitive, trying to make it very applicable to what their real world would look like.
Of course, yeah.
But then the younger kids you have to really change the way you engage with the way you set up your therapies. So I like to think of it where if you're a Star Wars fan, it's almost like you have to Jedi mind trick them into doing different activities. So the way you set up the environment can facilitate certain activities. It may be something that I come into a session, I know that I want to work on walking or I want to work on leg strengthening by doing squats or sit to stands. And so that's my goal as a therapist. But I may say, hey, I got 3 activities that you can do. It could be lightsaber fights. It could be like beanbag toss, or it could be basketball shooting.
Right.
Which one sounds most fun to you? And basically I take whatever their preference is from the fun side of it, and then I will try and get creative to be able to accomplish whatever my functional task is that I want them to practice.
So like if they say basketball and they say they're in a wheelchair, but they're practicing sit to stands, then you go out to the basketball court and you're kind of practicing them doing layups or something like, so you're implementing the therapy into the fun activity that they were told.
Yeah, exactly. So it may be that like their parent holds the basketball at a certain height where they cannot grab the ball and be able to shoot unless they stand up.
Okay.
So that's where I was talking about. You need to think about how you set up the environment and the task, because you got to think about safety. You got to think about what's going to motivate them, because the other thing is, if I could say we're going to do sit to stands and I hand them a basketball and they go, okay, well, I got the ball, I'm just going to shoot. Right. But I need to think, okay, how am I going to actually facilitate the action? Because I want them to play and have fun, but we got to get a little bit of the hustle in there too, so that they can make some progress. And especially the younger kids you have to be even more strategic and mindful of those things as a therapist. So, that was actually a big reason why I got into kids, is because I thought it's the most complex group to be able to treat. And so I'll never get bored. I'll always be challenged, and I'll always have to figure out new ways to move forward. So it's definitely, it's mentally challenging. It's physically challenging. It's takes a lot of focus for sure as a therapist.
Absolutely. And I mean, we talked a little bit about the space, but the space, looks really nice. And then we've got the upstairs too that I know that sometimes they use. The upstairs in our hospital has been redone in the past year, and it looks phenomenal as well. Like whenever you go in there, and I love it for shooting video and photo because of the natural light that's in that room. But just the paint on the walls and the activities that are in there, then the sensory gym side with the big swing in the middle, and then now the tree is in the corner. I mean, it just looks like a really fun, inviting place for a kid, and not in that old school kind of way where everything's like super childish, more in just a more fun, playful environment with colors where a teenager could come in there or a really young kid.
Yeah, no, we were very intentional when we were trying to build out what the design looked like, what the function of the space was going to look like.
Yeah.
And I think there's just a lot of small details that we're thinking about, what are these families experiencing at this phase, and how can we make it meet that need right now? So, just an example of that is, you talked about the treehouse sensory room. So we wanted a space where kids that may have more sensory needs, they could go and kind of de-stim.
What would be a sensory need for people that don't might not understand that?
So maybe a kid post brain injury, maybe they have light sensitivity. So the sensory input of light may cause headaches or things like that. So we would want a space where we can control that. And with sensory, you can look at it a couple ways. A lot of times after traumatic brain injury, a lot of times it's sensitivity to things. But sometimes there's kids that are also seeking sensory inputs. So they want certain sensory inputs to help them to maybe internally calm or regulate. And so we wanted a space where we can control some of those things a little bit. And on the note of control, thinking about that room, when you walk in, there's a swing that hangs from the ceiling, kind of like the swing from the treehouse, right?
Right.
And then we can make it pitch black in there if we want to.
Oh, I didn't know that. Yeah.
Yep. So we have the blackout curtains, and then we have LED lights across the top that you can change them to any color you want.
Oh, I didn't know that. I'll have to check that out.
Yeah. So it's pretty cool, just because you can change it to whatever color. There's actually a color changing mode too, so it'll kind of go between blue and green and purple.
Yeah.
But when you think about what these kids are experiencing during that time, think about a 5-year-old. They at that time are becoming quite independent. They're going to the bathroom. They're learning how to bathe. They can put on their clothes all on their own.
Sure.
They've learned how to walk. Like they've achieved most of those basic milestones from an independent standpoint. Obviously, we still need to very closely supervise kids at that age, but imagine just achieving all that independence and then all of a sudden it's all ripped away overnight.
Yeah.
And so a lot of behaviors arise for that population. And when you step back and you actually analyze what you're seeing, a lot of it's because kids have lost a lot of control.
Yeah.
They got that taste of independence and they like it,
absolutely.
That they get to have control and autonomy over, their lives and what they do. And then all of a sudden it's gone. And so you look at that space and it may not be the thing that like stands out to you, but the reality is that kid can go in there and the therapist is trying to work on goals, but the kid gets to control a little bit more.
Yeah.
So they can say, gosh, it's too bright in here. It's too bright in here. So that we can dim, the room as much as we want. Say, I like blue. They get to choose the blue.
Yeah.
We got a couple swing options. I really want to get on the swing. They get to choose that. And so
it makes them kind of feel like they're choosing their own adventure with their therapy.
Yep.
Yeah. Even though our goal is to give them therapy.
Yep. And that's a big part of the therapist being successful too, is trying to let the child lead the way and then directing them through whatever that goal is that you're trying to achieve.
Yeah, I mean, that makes a lot of sense as far as just especially having an 18-month-old son now and just kind of seeing that independence and whatnot. And yeah, you want to let them kind of guide it a little bit. So I'm sure that takes a whole other level. If I was changing immediately from being an adult PT down to a peds PT, that would you have to be a little more sensitive. Yeah, it makes a lot of sense that you have to kind of like pay attention to a lot of things that maybe you weren't having to pay attention to before.
Yeah, and well, the thing that's really unique is that they just can't understand it.
Yeah.
They definitely feel it, and adults feel that same thing. They've lost all this control, but
Sure.
but we can guide them through that as an adult, and we can oftentimes, not all the time, but we can cognitively, through the thought process, help them to kind of make sense of what's going on in front of them. Where a 5-year-old, even if they're typically developing, would just not really have the ability to come to that conclusion. So we have to really support them a little bit extra in that way. And that's where it's helpful to have that environment that's really intentionally set up for it.
Sure. Yeah. I mean, is there anything else that you want people to know about the Peds Day program? I think we kind of covered everything. Anything upcoming that you guys are excited about, or anything you want to let people know?
So things that we are working on this year, So just thinking back to the program overall, we started in 2022, about mid-year. And so we're still a relatively young program, but we've really found our footing. We've figured out a lot of our processes.
Yeah.
We are looking to see that we can keep a really strong, consistent high census. We ramped up very, very fast as a program.
Yeah.
And my hope is that we can position ourselves where we're preparing to start to look at, are there options for expansion so that we can serve more kids in a way that gives them intensive services, or maybe it's, community outputs. I'm not sure exactly what all those things would look like, or, what would need to be reformatted, but we're just continuing to want to make sure that we're serving kids, and no one really falls through the gaps.
Yeah.
That was a big thing when we were first initially starting this program. I told you one of the whys, but one of the other whys for why we started was because inpatient benefits are so limited for people.
Yeah.
And so we could have kids that have the most severe traumatic brain injury, and they only get a couple weeks of inpatient.
Right.
And the reality after a neurologic injury is that kids need far more than that.
Yeah, of course.
And if kids only have that amount, and then they are going out to home, and maybe they're in rural Florida or Georgia, they just don't have resources to keep that going. So I think back in my career and I go, oh my gosh, like what is going on with those kids? Because we took them as far as we could, but you kind of have to bless and release.
Yeah.
And so we built it now that we have this whole continuum, and really kids, I mentioned the timeline, but regardless of their insurance, we're really able to uniquely serve them and get them the right dosing for the right amount of time. So
Sure.
So I think that that's a really important feature. And we'll take all the insurances that Brooks Outpatient will take.
That's great.
So, there's not a limitation there. And I think it's really just a reorganization of our resources. And so that's kind of just how we innovated to create the program overall.
Yeah, and that's one of my favorite things about Brooks as well, is just that, we're always looking to innovate and improve so that we can serve more patients. I can't tell you how many parts of Brooks that I hear that. And I think it's just kind of an organic thing that we have going on in our culture, because we have so many really talented people that really care about our patients and the populations and our future patients that we haven't even met yet. So how can we, like you said, make sure they don't fall through the gaps and make sure we can serve them better? So, and the space that you guys already have, I'm sure, is already getting a lot of kids that otherwise would not have been able to. So
yeah, well, and we've been growing so much. I did mention that we've been growing a lot in Peds Day, and I mentioned that a large proportion of our kids come from our system, so directly from our Brooks inpatient. And the Brooks inpatient group has really been growing rapidly too. So we started our partnerships with UF Health and Nemours and Wolfson to help to ensure that all of our clinical standards are going to be at the highest level. And that started in October. And almost overnight, our volumes went notably up.
Yeah.
And so I think that we will continue to grow in that program. And so I am just kind of seeing the future a little bit, I think, in that, as inpatient continues to lessen that gap of kids that need the service compared to the kids that are getting the service in our region, we're going to need really to continue to grow our overall system. And I hope that it's not just going to be between, the groups and teams that we have here at this hospital, but really continuing to grow our community programs, continuing to grow our outpatient, all those different areas.
Sure.
So I am excited about that.
Yeah.
One other thing that you mentioned just a minute ago, just about all the things that we do at Brooks and just how we are an innovative company trying out new ways to serve people. I think I just wanted to maybe share my personal story and just why I think that it's so cool, the journey of how Peds Day started.
Sure.
When we first came up with the idea for Peds Day, it was back in 2020. Me and Bob McIver were trying to find another project for a student that we had that their internship was about to be canceled because of COVID. And Bob's like, "What do you want to do?" And I basically said, "Well, I've always had this dream clinic." And, we worked with that student to really put together data and try and put together dosing parameters and all the evidence that support some sort of center or, format for a program. And it got iterated quite a lot of times.
Sure.
But what I think is really cool is that I was just a frontline staff therapist, and after a little bit of time, I got the chance to present to Doug and at that time Dan and Chris and Victor. I felt very
executives at Brooks, for those that don't know.
Yeah. So just the fact that the top 5 people in the organization took time to listen to a frontline staff member.
Absolutely. Yeah.
And then I did have to present several times, which I think is great to make sure we've edited it and we're doing the right things. Yeah. But it started there and we're doing it.
I'm happy to say that doesn't surprise me at all. In fact, because they're just really great at that, of listening to what our frontline staff have to say. Because some of our best ideas have come from that. Think of all of our community programs that have come from our staff just working every day. Hey, it'd be so great to have this. And then all of a sudden, however long later, but maybe it's 5 or 10 years later, or maybe it's less, a building is erected and it's all about that thing from that one idea. So that's awesome.
Yeah. It's made my career nothing that I would have ever expected, but it's been extremely exciting.
Yeah.
And definitely very grateful for just all the opportunities because, it's very clear that just serving the community is such an important thing. And I hope it's come through in some of the things I've said, but our goal is really just how do we best serve the group of people that need our help right in front of us.
Absolutely. Yeah.
We're always trying to improve that, but it's just cool that we came with an idea and we're executing it and it's going great.
Yeah, that's awesome. Well, I really appreciate your time and sharing all that information. I'm sure a lot of people that didn't know about the Peds Day program are now fully aware of everything that's going on. And I encourage people to go to the website, brooksrehab.org, and also to our YouTube channel, which you can also find on brooksrehab.org. And I've got quite a few videos on there for Peds Day and other various aspects of Peds here at the Brooks Hospital and University campus. So thanks for your time, Steve.
Yeah, of course.